This is USMLE Step 3 Preparation Flashcards. What is the relation between anti-seizure medications and OCPs? What happens if you give both together? So if you give both together, anti-seizure medications such as phenytoin, carbamazepine, phenobarbital, ethosuximide, and topiramate, they induce cytochrome P450 in liver, and if they do that, they reduce the efficacy of OCPs. But the gabapentin and valproate, which are also anti-seizure medications, do not induce cytochrome P450 in the liver, so they can be given with OCPs. Next, how will you control pain in patients with focal bone metastatic lesions in hormone refractory prostate cancer and narcotics are not working? So basically, a patient has this prostate cancer, which has spread through the bone, most commonly the spine, the vertebrae, um, which is an osteoblastic lesion and not lytic. And you have tried the hormone therapy, you have tried narcotics, and still there is pain. So you will control the pain with external beam radiation therapy. Next, what is the diagnostic test for Hashimoto's thyroiditis? And the answer is you have to check the level of antimicrosomal antibody, which is anti-TPO. What are the signs and symptoms of juvenile rheumatoid arthritis? And the signs and symptoms are fever, salmon colored rash, polyarthritis, lymphadenopathy, myalgia. Minor criteria can be hepatosplenomegaly or elevated transaminase level. Next, what is the treatment for PNH, which is paroxysmal nocturnal hemoglobinuria? And the answer is glucocorticoids, that is prednisone. But in a patient who has PNH, who is transfusion dependent, blood transfusion dependent, who has severe illness, you can give them eculizumab, which inhibits C5, and therefore, if you inhibit C5, there is no complement activation, and that's why eculizumab is used in PNH. How is JRA diagnosed? Juvenile rheumatoid arthritis is diagnosed by there is no specific diagnostic test for JRA, but a very high ferritin levels as well as increased WBC count. And in juvenile rheumatoid arthritis, the rheumatoid factor is negative as well as ANA is negative. So high ferritin levels and increased WBC count. What is the empiric therapy for septic arthritis? And the answer is ceftriaxone and vancomycin. Ceftriaxone is given for gram-negative organisms and vancomycin is given for staph and strep. Next, what is the most accurate test for hereditary spherocytosis? And the most accurate test is osmotic fragility test. What antibodies are positive in scleroderma, that is systemic sclerosis? And the answer is 95% of the patient will have ANA positive, and anti-topoisomerase, which is anti-SCL70, is present in only 30% of the patient of systemic sclerosis scleroderma. What is the most accurate test for PNH? And the answer is CD55 and CD59 antibody, which are also called as decay accelerating factors. Thank you for watching.